So we did this on here too.
Right, tip it over,
Good morning again. God, it really does kind of begin to look and feel like fall, doesn't it? So, all right, you want me to use this probably. You're recording it, okay.
Thank you.
I just wanted to take a moment to add to a few things that Deb was talking about. We had a rather interesting survey here a little while back. And surveys are okay because they help us kind of do a self-check and a review of what it is that we've been maybe missing. Because sometimes it's really hard to see the trees for the forest. And you get about your daily work, and you get about your work, and you get about your work, and you get about your work. And sometimes the details of that work get lost a little bit. And this was a wake-up call for all of us to make sure that we attend to those details and make sure that we're constantly watching and vigilant for what we're here and what we're all about. And that's to take care of the residents that have entrusted themselves to us and to help with and assure that their families, that we're going to take care of them the best way we can. And that means each and every one of us, and that's me included, need to do a better job of being aware of what's going on in the facility. We can't fix something if we don't know it needs to be fixed. We can't address an issue with a resident if we don't know that there's an issue that needs to be addressed. So you're all empowered to be caregivers at Bethany. All of us are caregivers. Whether you work in housekeeping, environmental services, nutritional services, activities, whatever, we should be empowered to help to care for the residents in this facility. And if you see something that needs to be addressed, let somebody know about it so that we can address it. And if it doesn't get addressed and you've let somebody know about it, let them know about it again, and maybe let the next level of leadership know about it as well. Because we don't want to go through what we went through a couple of months ago again. We're better than that. We are better than that. And we need to do a better job of making sure we document and we watch for, we look out for, and we take care of the people that we have here at the facility. So that goes from some of the top all the way down. And I guess if I were a sheriff, I'd be deputizing you all to be looking out for the residents that we take care of. We have good teams in place. We just got a little complacent. And I'm just as guilty of that as anybody. So let's sharpen that edge. Let's be a little more vigilant. Let's all recommit ourselves to what we have committed to do here and follow the Bethany motto in providing for the care of the residents that we have in our chart, whether they're in a garden home or in need of care in our special care units. That's what we need to be about. Sorry for the kind of husky voice. I went to Canada fishing with my sons last week. Not only did I bring home some walleyes, but I brought home a Canadian virus as well. So I'm just getting better. I'm glad you didn't ask me to do this last Friday, because I literally hardly had a voice at all. So, but Deb did, and the team asked me to talk to you a little bit about infection prevention. And you know, we know that the problems that we have are that we're taking care of frail elderly whose immune systems are already a little bit compromised. The immune system is a system we have that helps us to fight off infection. And sometimes we have catheters, whether they're urinary catheters, they can be feeding tube catheters, they can be IV catheters if we're giving antibiotics and or fluids. Some of our residents are coming to us after surgery. They've had an orthopedic procedure where we put a metallic foreign object in their body which has no blood supply and therefore no ability to bring white infection fighting cells or medications to that metal object. So that puts them at high risk for infections. Healthcare settings in general have lots of organisms around, and we bring things to work that our residents may or may not be have been exposed to in the past. And the other thing that we've talked about in the past is we need to get better at indiscriminate and overuse of antibiotics, because as we've talked in the past, that is something that we are going to be held more accountable for. So our residents are more likely to get pneumonias, urinary tract infection. They may also get wound and skin infections. And so we need to do a better job of protecting those residents from those healthcare associated infections and infectious processes. What's the biggest single thing we can do to help with the spread? There's two things that I would love to hear you tell me. Two things that we can do as a staff to help reduce the spread of infections and infectious agents within the facility. Wash your hands and keep yourself healthy. Don't come to work ill. And the other thing that goes along with that one is make sure that you have all of the vaccines that are associated with vaccine preventable illnesses are up to date. When you come to work here, the HR department reviews your immunizations. They review whether or not you had a tuberculosis test. But one of the things that we don't review or require is an influenza immunization. And I just came from a meeting where we were talking about 3 or 4 weeks from now, we're going to start our flu season in terms of flu immunization. And I would encourage the staff to be vaccinated for influenza. You can get that here at the facility. You can go to your own provider. But it is important that we get, if you can get to 80 to 85% of a population, and we get that with our residents, but what we don't get that with is with our staff. You then get something called herd immunity, and it's hard to bring something into the facility like influenza. It's not, I didn't say impossible, it's just harder. And we will still get influenza in this facility because the guests that come in to visit our residents, the folks that are visitors, a variety of other people coming through our doors may or may not be. And even if I vaccinated 100 people, not all 100 are going to develop the antibody or the thing that protects you from the infection. It might require a second immunization. But the one thing about flu vaccine that appears to be apparent, if you get one year after year after year, it does help you to develop a more robust response and may actually be more protective. Now, it is usually the young, so you always hear about school children that get a lot of influenza, young adults, and the elderly who are the victims of influenza. And every year we lose people in South Dakota and in our surrounding states, and it's not unusual that the first typical victim of influenza is an elderly individual living in, say, a long-term care facility. But over the years, we've had 10-year-olds, 8-year-olds, 14-year-olds, 20-year-olds die from influenza infection. So again, I encourage you to give some strong consideration. I work at Sanford Health, and at Sanford Health, we have a requirement that all staff that can be vaccinated will be vaccinated unless they have an appropriate medical reason not to be vaccinated or an appropriate health, religious exemption. We will accept that. But if you have those two exemptions, when it comes to flu season, so the end of September, generally to the first part of March, when you're taking care of patients for only those two groups, you'll be wearing a mask all the time when you're taking care of a patient, or you're within 6 feet of a patient, a person, patient in our hospital. So we get about 98% of our staff that's vaccinated. And as you know, Sanford merged with the Good Samaritan Society this last year. And Good Samaritan did not have a requirement, but they are moving rapidly towards that requirement this year, if not for sure next year, where you will be required. And when you think about it, if you're in healthcare and you're not taking one of the major steps to protect the people that you take care of, that says something about the ethic that's involved in that decision. So just tell you it's fast coming, and there are some states that are now generating legislation that would require the folks that work in healthcare to be vaccinated. So let's go back to the hand washing. How long should you wash your hands? 20 seconds, or about 2 times through the happy birthday song. You know, it's always somebody's birthday, so you could be wishing somebody. And there's usually more than one, so you can sing it twice. Now, one of the things that people forget about, so they wash their hands, they go into the room. They do something in the room that maybe, and they put gloves on. They do something that contaminates their gloves, but then they go touch something else in the room. They just contaminated the surface. Let's say they were changing an undergarment for a resident. Now, if their gloves get soiled, they may go wash their hands. But once you're in the room, when you touch somebody or something that may be contaminated, remember you need to go wash your hands again. It's not just good enough to wash in, wash out. You need to wash within as well. And you always need to wash your hands after you take off your gloves, because you don't know if your gloves have been compromised. So we always forget about the inside of the room. So if you touch something contaminated, and now you go touch something else, unless you've taken off your gloves, because people always assume, I got gloves on, so I'm protected. But remember that this is more than just protecting myself. It's protecting the resident. And now, if you've done all this work to protect yourself while you're changing the soiled dressing or undergarments or bedding and touch something else, you may have put them at risk because that organism is now in the room on a surface. Our housekeeping folks are very important with regards to infection prevention in general and isolation. They clean the surfaces where these bugs tend to live. And it's important that our housekeeping staff understands the agents that they're using. How long do they need to be on a surface in order for that agent to effectively reduce the number of organisms that are on that surface? Is it 1 minute wet, 3 minute wet? I know that in our quality discussions, we're constantly looking for the simplest agent with the shortest period of time to make it most convenient for the housekeeping staff. I mean, imagine if you had to leave it on the surface wet for 10 minutes. It would take you all day just to clean 2 or 3 rooms. So Dan and his team and the rest of the housekeeping staff are constantly looking at new products with shorter periods of wet and contact time. But I can't stress enough how important you are to that process, the environmental services and the housekeeping team. Same goes for any other team that comes in and out of the room. Again, I said we're all in this together, and we're responsible to take care of the residents that we have by making sure we use the best practices that we can. The other thing that we'll be working on is, we get our patients are coming back and forth now to the hospital. The other thing that we have to be really careful of and cautious about and watchful for is how often do our residents end up back in the hospital? Readmissions to hospitals from long-term care facilities are going to get looked at, and facilities are going to be judged by how often they're sending residents back to the hospital. Now, that doesn't mean that we shouldn't send a resident that needs to be in the hospital there, but we also need to be more vigilant. Could we intercede earlier to maybe change the course of that illness so that that resident could stay with us at the facility as opposed to go to the hospital. I will also tell you that both of our hospitals are almost always at max capacity right now. They're not adding a lot of beds, and the population in our community is growing. And so we're not adding beds to the facilities, and the hospitals are full. So they're looking towards their partners in long-term care to be able to provide more and higher levels of care in their facilities to keep those folks out of the hospital. The other thing, it's better for our residents to stay here than to go to that deadly place called the hospital. Because they get confused, they fall, they hit their heads, they get bad bugs. Medication errors can take place like anywhere. We're all human, and we're subject to errors and human errors. So those are a few of the things that I wanted to talk to you about. And then the other thing that you're going to hear a lot, and it's going to be part of our quality plan. And Deb knows I hate the term QAPI, so we want to come up.
There's a $25 gift card out there.
Okay, so we want to come up with a really catchy name for our quality program. It is important that we review and look at and discuss. But I think happened to us in the quality process is we got really involved in the numbers, the metrics, that, and we sometimes forgot to relate that to what does that mean for the care of our residents. And that's what quality improvement should be about. What can we do better? What can we improve upon that makes the lives of the residents better? It makes the work that we do easier and more meaningful. Because it really, the bottom line is we have to like what we're doing. And if we can't make it meaningful and of some value to what you do, then we're going to struggle with making sure that the quality of work that we do is better. But another thing that we're going to need to be working on, and it's a tough one to work on, and we talk about the nursing staff, and that's reducing the number of antibiotics that we have our residents on. It's not, I didn't say not having our residents on, we just need to reduce the number of antibiotics that we have our residents on. Making sure that we're using these antibiotics appropriately so that we don't, again, lose them because organisms are becoming resistant to these medications faster than we can find new ones. If you really want to get a name for yourself, go out and invent or find a new antibiotic, because they're just not out there. And the bugs are pretty smart. And so you're going to hear a lot about, let's push fluids. Let's do something to make sure that the skin's not getting red or broken down so that there may be the potential for an infection. Remember, the largest organ in your body is what? Skin. So we have to make, and it's, as we get older, our circulation isn't as good, it gets thinner, it's subject to breakdown. When your skin is open, you leak. One of the skin's major responsibilities is to keep all the fluids that we have in us. I mean, it's our barrier to the outside world. So when the skin is broken or open or scraped or damaged, it's going to leak. So you may see some white purulent, not necessarily purulent, but white drainage or fluid or a variety of colors of fluid. That doesn't necessarily always mean that that's infected. It might mean it's open. But if now we see that color drainage changing colors and the redness around that area expanding, something might be going wrong here. I better let somebody know. I notice that wound is, or that skin is looking redder. Let somebody know so we can evaluate it, check it, see once if we need to intervene with pressure relief, different dressings, cleansing the skin in a different way, and maybe place somebody on an antibiotic because we truly do believe it's infected. Not all urine. Hunter.
What do you recommend? So let's say we were been talking about families a lot. So if you're a nurse and a family member comes up to you and says, they have a cough, start them on an antibiotic, how would you respond to that?
Well, they have a cough. Thank you for telling me they've had a cough. I wasn't quite certain. I thought I heard somebody coughing down that wing. Thank you for notifying me. I will be paying a little more attention to your loved one's symptoms. I will watch to see if the cough worsens, if they start to get short of breath, they get a fever, they don't seem to have an appetite, a variety of things. Just because we're not going to prescribe immediately doesn't mean we're not going to care for that individual. So we up our assessment, we watch. We maybe tell the team, let's keep an eye on the resident that Hunter just made. So let's make sure that they don't get out of hand. Because the other thing now that, at least in the acute care world, and it's going to come to the long-term care world, is a term called sepsis. Sepsis is where that infection is disseminated throughout the entire system, body, and it causes collapse of the body's circulatory system and a variety of things. A lot of attention is going to be paid to sepsis. Now, that may mean that in certain residents, we may get a little more aggressive with fluids. We might use some IV antibiotics here in the facility to treat in place as opposed to sending to the hospital. But it doesn't always start with just a minor upper respiratory infection. But we have to be vigilant and watch. And I think what you're hearing from that family member is, I'm concerned. So you as a caregiver can help them understand that you are concerned as well, and now I'm going to be a little more vigilant. And let's see once how they do over the next 12 to 24 hours before we rush in to start an antibiotic that could cause diarrhea, could cause nausea, they could end up being allergic to, and may not necessarily be appropriate.
It's having those customer service skills to be able to respond properly in those situations to say, oh my gosh, put mom and dad on an antibiotic. Okay, they have a cough, I understand that, but here's why that might not be a good idea right now.
Care isn't always done through a prescription pad or a thing like that. It's one, hearing what their concerns are, and rather than challenging those concerns, it's asking questions to understand. So maybe in that family member that Hunter is, what are you concerned about that I may be missing? And again, it's people want to be heard, people want to be understood, not necessarily challenged. And please don't say Dr. Heineman says we can't put your loved one on an antibiotic. Okay, that's not what this is about. It's about let's be a little more appropriate. Let's use our skills, in our clinical skills of our nurses to do that evaluation. Same goes for a urinary tract infection. Very common in the elderly, but more commonly in the elderly is the fact that they may have asymptomatic, which means no symptoms, bacteriuria. Means they have urine bacteria in their urine without a symptomatic infection. Very common, especially in elderly women. We do a urinalysis, they got some bacteria, lo and behold, they're on an antibiotic, but they may not have needed that. The other reason that we kind of have a rule here at Bethany that all elderly women, if we do collect a urine, we should use a quick cath, because it's very difficult to get an uncontaminated specimen from an older woman. It is very difficult. Males, it's relatively easy based on anatomy. You got a little area to clean off and you can get that. But a woman, it's very, especially an elderly woman, it's very difficult to get an adequate uncontaminated specimen. That's why if done properly, it can be done very quickly and very easily, and actually with less hassle for the resident. You're not trying to get them up on a bedpan or catch a clean catch, and it's just better. So wound, skin, respiratory, and then urinary tract infections will be the major things that we need. So again, it's not that we don't want to care for these residents, but the care has to go beyond just, the easy button shouldn't just be, let's put them on an antibiotic, because it can cause a whole bunch of other problems for you. So, happy to answer any questions that you might have. Kelly?
Just looking at the quiz.
Oh, the quiz.
Universal.
Am I not teaching to the quiz?
Well, I mean, you're teaching quite
Yeah.
well, but it just talks about universal precautions, so if you don't mind touching on that.
Sure. Universal precautions, hand washing is a big one. It's also, you want to isolation when necessary. We also want to be careful about isolation in long-term care because so many of our residents are already isolated. So we want to be careful about isolation. So it's really about those, it's washing your hands, making sure you're disposing of contaminated products in the proper container, doing what you're supposed to be doing. Isolation, and then reporting up through your chain of command with regards to antibiotics, the isolation. If you see something, again, you want to be talking to your charge nurse, the nurse that's on your team, and leading. What else did I not cover on the test, Kelly?
I think you did the
Yeah?
rest,
All right.
but
So that's universal precaution. That's something your teams you're gonna get repeatedly. Again. But when you're in a room, remember, yes, I wash coming in and I'll wash going out, but don't forget to wash within the room if you need it. And I know your activities, folks, are, there's all kinds of things that we can do to enhance our residents' lives. And we heard last summer, there's now a list in the rooms of simple activities and things that we're watching for in our residents. If our residents are happier, they'll be healthier. They will be healthier if they're happier. And those are the kinds of things and responsibilities that we should take more seriously. So, and Deb mentioned we're going to do these on a monthly, or we're going to get together and talk whatever our new committee is going to be called on a monthly basis, primarily so that we are on top of things a little more than once a quarter, and that we're all looking at this and we're making a commitment to improve the care that we provide to the folks that we care for and have asked us to help them be cared for. So, other questions?
I just have a couple comments.
Yeah.
What time is the meeting here?
9:30, but Hunter could go.
Okay. I want to talk about our flu shot expectation. It's in the handbook, and basically it says it's part of your uniform. Remember we talked about ethics? You need to come to work in appropriate attire. That means your flu shot. It's your moral and ethical obligation to get a flu shot for no other reason other than to protect our residents. We do expect that of you. We do expect that if you have some sort of religious or health reason that you can't get the flu shot, that you will bring that to the director of nursing, and then you'll be approved to wear a mask to work during the entire flu season. But we do expect everybody to get a flu shot. Joanne and Katie, where were we last year? Were we getting closer to like 90%?
I think so. We only had about 4 in Sioux Falls that had to wear the masks. the full
Yeah.
time.
And we're doing a much better job with this. So thank you, Dr. Heineman, for your leadership on that for us and making sure that we're protecting ourselves and our residents.
All right. And just again, I know that the last couple of months haven't been very much fun, especially for the administrative teams with regards to answering the state. But again, if we look at it as an opportunity to reset, and now let's be a better place, a better facility, a better team. We all take a little better responsibility, and I think what will happen is we're gonna come out of this a whole lot better. We're gonna, like I said, be a little more aware. I've never been in the military, but my father always talked about your bed had to be made just right, corners crisp, sheets tight, and making sure that we're gonna be, we're there and we get back up to where we deserve to be as an organization, so. All right.
Another thought?
Oh, maybe Hunter, you should come on. She's got all these thoughts from Deb.
So hospital readmissions, and that family member who comes over and says, my mom has a cough and I need you to call the doctor and get an antibiotic. We have a new member of our team at Bethany Home Sioux Falls and soon at Bethany Home Brandon. At Bethany Home Sioux Falls, that member is Little Joe. Little Joe is our Avera E-Care. We named it affectionately Little Joe. We got Big Joe.
Should have called her Sister Joe.
Sister Joe, that's a good one too. But we were thinking it's a cart. And I just thought of Little Joe Cart, right? So, so we got Little Joe. And really, really think of this as a member of your team. There is no reason you can't call, and that's how it starts with using Avera E-Care. Just call them and say, I have a family member who's concerned that their mom has a cough, and I just want to talk to you about it too, and maybe they'll want to see the resident through the use of the cart. Maybe they'll encourage you to ask or respond the same way Dr. Heineman did here today. But it's a deepening of our bench. We have access 24 hours a day, 7 days a week to medical expertise, to certified nurse practitioners, to physicians, to PAs, to people who are specially trained in the different areas that we can access. And so we really want you to reach out to them to help us. If we're not sure, should we send this person to the hospital? If we're not sure, should we be asking for an antibiotic or whatever it is, call them anytime. Okay? And again, soon that will be out in Brandon. Do you have any other comments?
I do not.
Any other questions for Dr.
Are
Heineman?
the Twins going to make the World Series?
That would be awesome.
They lost last night, but it's
Oh.
okay. They lost to the White Sox. So I think there are 2 games up now in Cleveland. So.
That's awesome.